So in part 2, we're going to be talking about pharmacology basics when it comes to pharmacokinetics and pharmacodynamics. So these are really important characteristics of a drug. With pharmacokinetics, that's actually a measurement of what the body does to the drug. So as the drug moves through the body system, how is it distributed through the body? How is it excreted, metabolized, etc.? Okay. The PD, or pharmacodynamics, is what the drug does to the body. So what is basically the relationship between drug concentration in the body and the effects, the biological, physiological effects on the body of the drug. And those two things together help to determine the type, the degree, duration, etc. of our drug's effects. So looking more deeply into pharmacokinetics, it's really looking at how fast and completely the drug moves through the body. So we have various steps here, and we'll outline each step. So absorption, that's often the first phase. So when you take a medication by mouth, it has to get absorbed into the body. You put a patch on, it gets absorbed through the skin, right? So absorption is important to take into consideration, how well a drug is absorbed and available, available for use. Okay. Next, we have distribution. So distribution looks at essentially where the body goes through, or where the drug goes through the body. So how the drug becomes distributed throughout tissues, compartments, fluids, throughout all pieces of the body. And some go everywhere, some go very small places. The distribution can be quite varied depending on the individual properties of that drug. Metabolism is the breakdown of the drug. Now, not all drugs are metabolized. So if, say, you take a drug that's an element, like lithium, you can't break down lithium. It is already an element. So there's no a specific metabolism that happens there. But a lot of drugs do get broken down by enzymes that, say, our liver makes. And there are differences in these properties in particular that can be genetic in nature. So there are genetic differences in how much medication, depending on the medication, gets broken down, which may mean someone needs a different amount of medication to get about the same quantity hanging out in their system than someone who has more or less of those enzymes. And that's where a lot of pharmacogenomics comes into play. We also then have elimination. So elimination is how the body removes that drug product from itself. So it can be eliminated through exhalation, sometimes through sweat, through feces, through urine, however it's taken out of the body. Okay. And all of these pieces together kind of give us a good idea about how the drug moves through the body. So to break it down a little bit more in detail, absorption is the movement of drug from its site of administration into the blood. Okay, so it has to get into the system essentially for the drug to have an action. Now, we do have things that are like just stay on the skin, etc. But in general, this is important. So if we're taking a drug by mouth, there's a number of factors that affect how well that drug gets absorbed. So we have the blood flow in your stomach, in your intestines. So if you have poor blood flow from GI or gastrointestinal disease, food can sometimes impact the absorption of medications. So some medications are actually absorbed better on an empty stomach. Some are absorbed better when you have food in your stomach. Some, it doesn't really matter. The pH, or the acidity or basicity of your stomach, can affect absorption as well. So if you're taking, say, a proton pump inhibitor like Prilosec, that basically increases your pH. It makes it more basic, right? And sometimes if you have a less acidic or more basic pH in your stomach, that can affect how the chemistry of a medication works and may impact absorption. Okay. There's other things to take into consideration too. So, moving through the mucosal epithelium and how well that happens, what those defenses look like as the body tries to defend against certain chemicals and certain irritants, etc. Right? But most medications will be able to diffuse through those layers, that phospholipid bilayer, or potentially attach to transport proteins to be carried across the membrane. When we're looking at absorption, administration through the oral route is one of the more common ones, right? So drug administration by mouth is taking, say, a pill, for example, and there are a lot of benefits. It's pretty easy to do. Most people can handle taking a pill, although sometimes it is a challenge. It's generally inexpensive, it's typically painless, and it's less likely to cause challenges based on how it's administered. So if you were to inject something, it's much more likely to be a risk for, say, infection. Cons: you have to have a pretty stable product because it's going through the stomach, and the stomach has a lot of acid in it. It is a little bit slower than, say, injecting directly into the bloodstream. It does go through what we call the first pass of metabolism. So when it goes through the gastrointestinal epithelium, the drug is carried through what we call a portal system directly to the liver before it goes into systemic circulation. So that portal system helps to detox, right? It helps to clear out some toxins before it gets into your whole body. So some medications may be partially inactivated when it goes through this first pass, and we call it the first pass effect or first pass metabolism. So some products have a high first pass metabolism. They may need larger amounts of that product for it to make its way into the bloodstream at a high enough concentration to do what it needs to do, right? So we can also have challenges with incomplete absorption when someone maybe has changes in their gastrointestinal tract, like they've had a gastric bypass, for example, right? So lots of pieces can come into play when it comes to absorption of drug products. When it comes to the injectable route, we also call this the parenteral route. So this is typically going to be administered more directly into our systemic circulation. However, you might think injectable, first thing that comes to mind is intravenous, and that's probably the most common one that people think about, but we can actually inject drugs into a number of different spaces. So SC, or subcutaneous, that goes into the adipose, or kind of fatty tissue that's between the skin and the muscle, right? So you have your skin, your adipose, and your muscle. Subcutaneous often is insulin, for example. It has a slower onset, but it is very favorable for oil-based drugs. It can kind of sit there and do its thing. The challenge, too, though, with subcutaneous injection is that adipose tissue can really only handle pretty small volumes of substance, right? So if you need, half a liter of fluid, it's really not going to be well done to inject it subcutaneously. But if you're having, a milliliter or less, not too big of a deal. Intramuscular goes into the muscles. Oftentimes it's the deltoid muscle up here, or the gluteal muscle in your booty, right? But we sometimes will do thigh muscle, for example, and that goes into the actual muscle tissue. This tends to have a slightly faster onset than subcutaneous. It works well for our oil-based drugs, but we still have to really take into consideration that volume. So anything more than about 1.5 milliliters, 2 milliliters, gets a bit too big for it to be comfortably injected into the muscle. Now, this tends to be less comfortable as well when compared to subcutaneous. The muscle can get sore if you've ever had, say, a flu shot or a vaccine. The muscle gets a little bit sore the next day because you've injected into it, so you've damaged the tissue a little bit. Intravenous goes straight into the vein, and this is a really rapid delivery, right? It goes right into your bloodstream. You can control the amount because there's no effects that really are going to do a good job of deviating the amount that you're giving them. So if you give them 100 milligrams intravenously, they're getting 100 milligrams into their bloodstream. So very predictable from that perspective. However, it can be quite quite painful, right? So it can be painful to get an IV started, to maintain that IV. We also can have revascularization, where if it's an irritant, that it can inflame the vein as well. So we have to think about that. And of course, once you put something into someone's vein, it's very difficult to take it back out. So any reversal option is quite difficult to do. We also have, fairly rarely, intrathecal, which actually goes directly into your cerebrospinal fluid. So it actually goes into the space between the vertebrae and into your spine, right? So that actually is a wonderful way to bypass your BBB, your blood-brain barrier. So even if you inject stuff, there might be some challenges with it getting into the central nervous system. We don't do this very often because the central nervous system is very sensitive and the risk of infection is pretty dang high. There has to be a very well-trained individual who offers this, and we have to be very, very cautious about introducing infection into that intrathecal space. That can be quite dangerous. There are also a number of different routes of administration that we're not going to spend as much time on, but it is important to take into consideration. So we have PR, per rectum. So there's actually a lot of absorptive tissue in the rectum, so it can absolutely be a route to absorb drug products. Topically, which can go through the skin, or transdermal, sometimes we say. Inhalation. SL is sublingual. Which basically means that you place the medication underneath the tongue, or sometimes in the cheek. We call that a buccal, or you might hear buccal, but buccal. That absorption actually is in the mucosa of the oral cavity. So some products are absorbed that way. Nicotine gum and lozenge is actually absorbed sublingually or buccally. Right. If you chew nicotine gum like normal gum and swallow the saliva created from that, or if you chew and swallow a nicotine lozenge, you're just going to get a big old stomach ache, and it's not going to absorb all that well. It does much better through the oral mucosa. We also have intraosseous, which goes directly into the bone. So in some emergent situations, if they can't get an IV or an intravenous access, they may actually drill a hole into the bone to be able to deliver medication through that route. So lots of interesting ways to deliver medication. This is certainly not the fully comprehensive list, but the more common ways with which you will see medications administered.